Good afternoon and welcome to Premier Fitness and our Facebook Live Lunch and Learn. Today our featured speaker is Jim Pierce-Ruhland. He is the director of the ACMC Rehabilitation, and he's going to give you a tour of his new facility and answer any questions that you have. Okay?
Thanks, June. I'm Jim. Excited to announce our new location. We're neighbors now with Premier. So without further ado, show you the way. So our main entry comes through these double doors for Premier Fitness. We do have a separate entry exit, but these are now motorized doors. So we've got nice handicap access. So these are our entry doors. And we've got our reception off to the right. Let's say hi to these folks here. Tammy, Don, Jay, say hi to the camera. Hello. So these are some of the guys that make the office work. So I'm all back here. Got a reception area. So sure. And then we'll walk back here. It's been a couple years in process, but thanks to the engineering crew, IT, whole bunch of different folks that came together, Tammy and Etkowitz and the ACMC Foundation, administration, the board for getting the project off and getting it going. Huge transformation and a major upgrade from where we came. If you want to come around here, so we got patient scheduling. We have some lockers here for patients. That was a feedback in years past for patients to have a secure place to put something. As patients are finishing up their appointment, they're going to schedule for follow-ups here. So this is our front gym. We've got treatment areas about double our square footage from our prior locations. About 5,500 square feet in this area. So we've got a nice front gym and then a separate back gym. I'm going to show you here in a second. Go ahead and walk back here and we'll meet Cassie and Cody. Guys, say hi to the camera.
Hi.
And Vera back here. These are some of our physical therapists and physical therapist assistants that help see patients every day. This is more of a documentation station. And then off to the side we have an occupational therapy area where we'll see hand, shoulder, extremity, upper extremity, carpal tunnel, stroke rehab, you name it. All right. Going back here, we've got individualized treatment rooms and an area for cervical traction, lumbar traction, treatment for the back, for the spine, and also patient evaluations where it's a little more private. Here we have just a section for modalities, heat, cold, some general storage, patient restrooms off to the left here. Another treatment room. I've got an abundance of treatment rooms. So you can see multiple patients at once, and it doesn't feel like we're on top of each other. It feels like we've got nice spacing. Over here we have a room a little bit more dedicated towards balance, dizziness, and vestibular care. So one of our specialties that we treat is balance and dizziness, fall prevention type things. So there's a lot of nice things that we can do for that. All right. And here I want to introduce Amber and Amelia.
Hi. Hello.
This is our speech therapist. Amelia is a speech therapist student. And if you want to say a few words to the camera about what you treat.
What we do, so we're the only speech therapists here, so we see kids, adults. So adults, we see Parkinson's, post-stroke, TBIs, brain injuries, that kind of thing. And kids, we do everything from autism, speech sound disorders, language disorders, late talkers. We kind of see it all. So that's what we do mostly.
All right, thank you, Amber.
Mm-hmm.
All right, moving back along, we get more to a pediatric dedicated room. And we have more equipment coming thanks to Tammy and the foundation. Sensory swings, different type materials. And if you look back off to the left here, we've got a little view window. If you guys want to go back around, you can wave as a parent coming in. Sometimes it's appropriate for a child to be if behaviors or certain things, they're not interacting well with the therapist, with the parent in the room, the parent can go out and look through the view window and still kind of keep connected, but be a little bit out of sight, out of mind, so the therapist can achieve some objectives with the treatment. We'll see gross motor delay, fine motor delay, a lot of different things where we're working on desensitization, treatment of children with autism, handwriting skills, just the enhancing the ability for a child to be age appropriate with play. Different thing. Another individual treatment room here. So we have 2 more offices, individual treatment offices than we did in the previous location. And then back here is kind of the room to move. So you'll notice the rubberized floor. It's a different surface than the carpeted floor. It's a space where we can move a little bit, test our athletes out. We've got a nice, almost 11-foot ceiling so that we can do vertical activities, overhead sports. This section to practice balance care as well. But it's a nice, forgiving surface. You guys did a great job on it. All right. As far as patients that we treat from a physical therapy standpoint, as I mentioned, balance and vestibular care, pediatrics. We also work a lot with orthopedics, post-surgical care, total joints, total hips, knees, shoulders, sprains and strains. It's shoveling season right now. We're seeing a lot of slips and falls, seeing some back strains, neck strains from hoisting the wet, heavy snow. So lots of those different things. But we are available by referral for OT and speech. PT, you can either be seen by referral or through direct access.
They can't see you with feet.
They can't see it. They only hear me. You can hear me, but you can't see me.
They got the black screen.
All right. We're going to hit pause.
He's on the phone with friends from the hospital.
Keep going. Do you see me now?
It says no, it's okay. Can you see it?
I've been seeing it.
All right. Well, we'll keep going. So, post-surgical care. Obviously, we're looking to avoid surgeries if it's possible through appropriate rehab, strengthening, prevention type things. But our whole gamut of care, from infancy to the elderly, we're happy to serve you. We got a good crew. We have fun. It's nice to come into a new facility and be connected with Premier. We envision some wellness programming that's going to come out of this. Our patients that are getting done with their care here are going to ideally continue their care afterwards, their home programs, through a wellness program with Premier or in general. But we like what it's given us, a lot of opportunities here. All right, I think we can head back up here and see the second half of the gym. Are they all finishing up there?
Still there.
Just about.
I have a question.
Sure.
Some people would be apprehensive about coming in
Yeah.
without a doctor's referral.
Mm-hmm.
How can they do that and feel comfortable about doing it?
So our phone number is 440-997-6680. I will tell you the majority of our cases are referred cases through the physician, through their primary care physician. We're on Epic, so we can see the doctor's notes, they can see our notes, we can send staff messages, and if we pick up on anything at that first visit that this needs your doctor's eyes on it, we're going to send that patient back to the doctor, we're going to send a quick message to their physician. So occasionally some insurances are going to require it, but that's getting less and less in terms of a referral to see us. So yeah, it's a new paradigm, and it's not typically the most common way of patient accessing us, but it's been Ohio law, and many of the states have adapted. I think most at this point have adopted direct access. Statistically, it's a cost saver, is what they've seen, and the safety is no less. So if it's a barrier for the patient to take the steps of going to their provider and then coming out, it's one visit less for them. But I will tell you, most of them, we like to have that physician interaction or nurse practitioner or physician assistant referral. We value that relationship because I think it's critical for the long-term health of the patient. But yeah, good question. All right. Any other questions?
Not right this minute.
Not yet.
We'll head up
All right,
and see the other part.
Let's go ahead and head up here. Oh. We ended up moving on the snowiest day of the year. That was an experience. Go ahead and tour this side. So we've got individual treatment bays for our patients. We're able to curtain off for privacy. Again, we've got nice spacing. Keep everything at least 6 feet apart.
Nice thing about that is
We've had the ability to test equipment positions and then move them again and try to isolate the most efficient use of space. So we are a long, narrow rectangle, about 30, 35 feet wide and about, I think, 150 to 180 feet of length from the front to the back of the building. I think that's all I have. I mean, I think those cover the key points. We also provide services in clinic in Jefferson, clinic in Conneaut, and family health centers there. Several therapists in those locations. We provide clinical care to inpatients on the acute hospital side, so PT, OT, and speech there. We have trainers in several schools, athletic trainers at Lakeside, Edgewood, and St. John. One of our trainers works in direct in the office suite with Dr. Bird in our orthopedic section, or orthopedic department, and we have a lot of communication between those two departments. So, if a student athlete gets injured and our trainers see that, they can get a direct link in with a Dr. Franley or Dr. Burden to accelerate that child's care so that they don't have to delay, particularly concussion care. If a child suffers a concussion on the field, they need to be removed and they need to be cleared by their physician. So I think that team and Dr. Franley does a great job. Kim at Edgewood, Kathy at Lakeside, and Stephanie at St. John. So it's a nice, well-rounded care where we're trying to serve all these gaps.
So what are your hours?
Good question. So we'll be a little bit flexible. Like if we have a patient that needs a little bit of an outside the typical hours, we can accommodate that. But generally speaking, we're 8 to 6:30 Monday through Thursday in this location, and 8 to 5:30 on Fridays. The satellites have a slight variation on that because there's fewer clinicians, so they run slightly more condensed hours. But generally speaking, between those hours, we can get you served, get you seen.
I have a question. You may have answered it and I missed it, but I know the speech therapist.
Yes.
She's a specialist in that. Are
Yes.
your therapists specialists in certain areas, or are they pretty well-rounded that they could help?
Yeah, that's a good question. We have, I believe a total in our department, 10 or 11 total PTs, if I'm counting all the facilities, inpatient and outpatient. 1, 2, 3, 4 OTs, 2 speech therapists, and I would say about 6 PTAs, so physical therapy assistants, and 2 CODAs, so certified occupational therapist assistants. Each clinician tends to have their own niche kind of specialty where they enjoy treating. Most are cross-trained to serve many locations. Some specialize a little bit more in pediatrics. Some specialize a little bit more in balance and vestibular care. Most have a nice broad training in orthopedics. A couple of therapists have training in dry needling, which is a skill akin to acupuncture, but it's kind of the Western alternative to that. It's not to be deemed the same as acupuncture, but it's the use of acupuncture needles to release trigger points. So several of our therapists are trained in that.
And you treat vertigo here?
Yeah, we treat vertigo. That's certainly one that's near and dear to me. It's one of my most favorite to treat. We have several therapists that also treat that. So spinning, if you wake up in bed, roll over and you're spinning for 30 seconds, 60 seconds, there's often a very quick fix for that. It's the most common cause of dizziness. And we're talking rapid recovery, rapid improvement for most cases. There are other causes of dizziness which we can identify and program and typically yield really good results out of it.
You are the director, but do you also treat as well?
Yeah, I'd say between 15 to 30% of my time is spent in clinical care. I enjoy it. I like it. Sometimes it'll pull from the paperwork side and scheduling side, but I do enjoy it. So if we flex up or if we have somebody off for various reasons, I'll move more into the clinical care, usually in the outpatient setting. All of our therapists typically rotate, almost all of our therapists rotate into both inpatient and outpatient setting. Good questions, thank you. Hopefully the feed worked, and welcome any of your other questions that might come up after this or as viewers watch it. So feel free to call us, like I said, 997-6680, or email me. Be happy to get back to you.
You don't necessarily promote long-term. You try to. It
Well,
depends.
I think when you're dealing in like a therapy referral or a therapy episode of care, you're probably talking from a handful of visits up. Some will need a lot. Some will need 20, 30, 40 visits, depending on the diagnosis. But a lot of times we're done in 6 to 10 visits. We can make a pretty significant impact there. Some insurance restrictions are going to hold us back from going more. Some will be a little bit more forgiving. So we'll try to train the patient and focus on education and prevention. Whatever we can teach the patient to do, ideally we'll teach them here, and then they go next door and carry on their mission, and hopefully have a little better semblance of how do I stop this from happening again, and what are the things to look for if it is going to happen again, so that I can head it off to the past. And we always welcome that too. If you've been a patient through here, it doesn't mean you can never stop. We love it when old patients come in and just give us a quick update, or just a say hey, and hey, I'm doing great, or this is what I ended up having to do. Always love hearing from patients who have come through our doors.
Thank you for the plug.
Oh, for sure. I'm looking forward to to having a new neighbor. So it's a nice upgrade.
Okay. Well, thank you very much for your time.
Thank you much.
Thank you.